Hello, everybody. Welcome to another episode of Chatter and Calm with the wonderful host, Scott. And we were touching in a very wonderful topic, which I think it's very misinterpreted, and there are so many benefits out of that. So Scott is touching that subject and actually teaching us about the reality of it. So we are talking about cannabis in 2025. So we put out a video already, so this will be the second episode of it. So Scott explained so nicely through many experience in that, knowing that field, like associating and all that. He had been doing that business for a long time. So without further ado, I'll hand it over to Scott. So Scott, thank you so much, and for especially bringing this. We had discussions about this and bringing up this topic. So, to start our discussion, or like actually, you are teaching us here. So, is there something you would like to bring up before we start?
Oh, hey, well, first let me say thank you, Sanji, for hosting and directing and guiding this and all our previous episodes of Chatter and Calm. Um, it's an honor to work with you and be in your presence in general. And uh, yes, this is the second episode of our cannabis presentation. Last week we did a nice kind of introductory set, and now we will kind of go down the path of maybe talking about the differences between recreational, which is also called adult use cannabis, and medicinal cannabis. And there are a lot of and it's a funny topic because on one hand there are a lot of differences, but on the other hand we're all talking about different ways to use stuff that comes from the same plant,
Uh-huh.
right? And so that just excuse me, I'm gonna
Sure, sure.
put a piece of paper here because
Yeah,
no,
sure.
you're fine. No, I just I every now and then I as I talk, I get ideas and I
Uh-huh,
like to put
wonderful.
them down because they're good for this and they're good for other things as well.
Mm-hmm.
But um, one of the things I should say to start this talk is that it's one of the amazing things about cannabis, is that I do believe it might be one of the most hybridized plants in the history of humankind, right?
Mm-hmm.
Because um, the primary component or molecule that people search for from cannabis is called delta 9 tetrahydrocannabinol. And this is the substance that makes you high. It's described or categorized as a psychoactive substance, and psychoactive means it changes the way you think or perceive things.
Mm-hmm.
And so people have been uh, genetically manipulating the plant. They'll find two different plants that have different qualities, and they'll take um, the flower from one plant and the pollen from another
Paul.
plant and mix them, and then they'll get new seeds that have combined characteristics of the two different plants, and then they grow that plant or they plant those seeds and see what happens. And this is so for the last, gosh, probably 50 years, the goal really has been trying to create plants for the most part that have higher amounts of THC.
Mm-hmm.
And every now and then what they do is they'll take the flower, which is also called the bud, which is the part that has the most amount of THC from a marijuana plant. They dry it and then you send it to a laboratory and you get it tested.
Mm-hmm.
They test it to make sure there aren't any poisons or anything toxic in the plant that arrive due to um, nutrients that are fed the plant or watering. Occasionally someone will use water that's not clean and
Oh,
that can infect the plant with something like E. coli, and which can make people quite sick. But
I see.
the other purpose in testing a plant is to determine how much the cannabinoids are in the plant. And the first thing that people tend to look at is THC. Now, on occasion, you see test results of THC hit up to around 30%, which is really, really, really high. That means 30% of that bud is THC,
Mm-hmm.
and um, and that's really, really strong. And also, that's a level that most people who are knowledgeable about growing or about the plant kind of shake their head, because that's kind of it feels unrealistic. Um, but again, the desire for people growing and genetically modifying the plant is to increase the amount, either increase the amount of THC or decrease the amount of THC.
Mm-hmm.
Because if you want to sell hemp, which is traditionally used for industrial purposes, your plant has to have less than 0.3% THC. But when you're selling the plant for recreational users, and also, honestly, medicinal users often want high THC levels.
Mm-hmm.
Um, so that's why you have everyone kind of tinkering with genetics. Let's mix this with that and see what happens, or let's try this. Um, and they do this in order, again, to create a plant that produces as much THC as possible. Because unfortunately, when people go to stores, that's what they're looking for when they buy what's called flower, which is just the bud in a dried form in a jar, take home, and then they can smoke it with a pipe or a bong, or roll it into a cigarette that's often called a pre-roll or a joint.
Mm-hmm.
There are so many different names for that. They have names. They make things called spliffs also, which is a mixture of cannabis and tobacco. Um, because that kind of gives a nice, that combination gives what many consider a nice, pleasant high.
Mm-hmm.
And again, now that's why most people are buying, consuming cannabis, is because they want to engage in something that's called a high that you get from consuming THC.
Mm-hmm.
And yeah, that high, you feel it a lot in your mind, and it often relaxes you.
Mm-hmm.
Um, it makes it can make light a little bit lighter. It can make food taste a little bit better or different. It really has a multi-pronged effect on all your senses.
Mm-hmm.
And often, people just smoke just because they find it relaxing, right?
Mm-hmm.
It can help sleep. It can help relax you, and mostly, honestly, I think most of the people who consume cannabis, I truly believe, just consume it to get out of their present mindset.
Mm-hmm.
Because frequently, the day to day routine or uh, contributes to the presence of stress in a lot of people,
Stress.
you know, and what they do is they'll consume some THC or cannabis in order to get out of that mindset of being stressed.
Mm-hmm.
And I used to say that people who consume recreationally just take it to go to another place.
Mm-hmm.
And because you can't always just hop in your car and drive to another spot. sometimes it's raining or really cold, or you have people you have to take care of, and consuming cannabis is good, um, is perfect in that space because you can do it in the privacy of your home. It's also good because, for the most part, it's not physically damaging. Actually, there are many parts, a lot of cannabis, actually, let me say that differently. Cannabis and THC have a lot of medicinal aspects,
Mhm.
and so that brings me to only 100 different things I can talk about there.
Oh.
I mean, one thing I do want to get into is the use of cannabis as medicine, and not
Mm.
just recreational, not just recreational usage. Now to finish up the recreational usage, I personally, um, often, like, if I am planning to go see a movie, I've been known to consume cannabis right before the movie, because when you watch a movie, you're in a dark space, so nothing else is happening. You have this big screen that takes up all your attention, and so you're watching this movie. The purpose of watching a movie is very similar to the purpose of consuming cannabis, which is to distract your mind from everything else that's kind of
Mm.
bothering you, stressing you out, or torturing you. It just uh, and I guess that's why those two things go so well together.
Mm.
Watching movies or something on TV, because the cannabis will relax you, and then you watch it, and you become very, very engaged in it, and but it's done in a way that it isn't physically destructive or harmful or toxic, like a lot of other things that people take. I'd say most of the other things on that list of things that people take to mentally distract them, like alcohol, or any of these drugs like heroin, are quite physically destructive, and societally destructive as well. Um, and this is well, let's go on with the medicinal, and then after we talk about medicinal cannabis for a while, we can talk about the stigma that is attached, the unfair stigma that's attached to cannabis. At least that's my opinion, that it's misguided and unfair. But let's talk about medicinal cannabis for a little bit. Do you come across anyone in Sri Lanka, Sanji? Do you know anyone, or are you aware of anyone that consumes cannabis for medicinal purposes?
Not so much, Scott. Not so much. Like we hear, like some Ayurveda products and all have a little bit of cannabis in them, like Ayurvedic medicines. They use
Yes.
some kind, but very little amounts. But
Hmm.
like what we hear from the other countries, like people, they just, I think, use for uh, even like some food they use, but I think they cannot use it like legally. So
Okay.
even like when they are smoking for like just to change the mind and all. So
Hmm.
uh, then most people are doing for that reason.
Okay.
And even like some people when they're cooking and all, I remember like they used to say like even if you put it to meat, it would tenderize the meat.
Oh, really? That's fantastic. I
Yeah,
didn't know that.
really. So I don't know how it's done, but there was
Hmm.
an uncle of ours who used to
Hmm.
say this all the time, and
Yeah.
I'm sure like he used to use it. He used to always use his pipe to smoke like tobacco, but I'm sure like cannabis also was a part of that. So
Yeah. Yeah. No, that's interesting. Because I was in was and still kind of in, I'm in, still kind of am in the cannabis industry. The idea of making a meat marinade out of cannabis is something that had never occurred to me.
Uh-huh.
Um,
Maybe
I
good
mean,
idea, right?
yeah, no, as hemp, I'm reading that it's a very good source of feed for animals.
Animals. Oh.
And one of the growers I worked with frequently in Washington State, he had a farm on which he grew cannabis, but also on his farm he had cattle and chickens and turkeys and
Mhm.
pigs, and he fed all his animals. All of his animals were fed hemp, or
Mm.
I mean, he actually that's not entirely true because he never grew cannabis at that point three at the point where it would be considered hemp.
Mhm.
He always grew cannabis purely for its intoxicating effect or
Mhm.
psychoactive effects, let's say. And so he fed. I don't know. I wonder if his pigs and cows and chickens got stoned. I should have asked him about that because that's funny. Like see pigs just lying around staring at the sky, or cows just kind of nosing their nose round, kicking a little rock around with their nose
Uh-huh.
or something. I don't know. Um, but I did eat. I did eat some of his produce. Some of his. I don't know why I don't like the sound of the meat from his animals.
Mhm.
I don't want to offend any vegans, I guess.
Sure, sure.
Um, but it was very good. It was very tender, but also, it wasn't produced on that whole industrialized scale of meat production.
Mhm.
So it,
Mhm.
didn't put any steroids or antibiotics in his animals.
Mhm.
Um, but we should talk, along the lines of medicinal usage of marijuana. My first 2 or 2.5 years in the industry, I worked with my brother in New Mexico who had a medicinal marijuana company,
Mhm.
and that was fascinating. When I first started, I was quite skeptical, and I'd see all these people lining up in a room to buy their cannabis. And I was scratching my head when I was new, and I was thinking, "Oh, you guys just want to get stoned, that's all you
Mhm.
want."
Mhm.
Um, and and that was unfair, really, because it was after about 3 or 4 months that I actually started. I worked there for a bit and just kind of to learn the ropes and
Mhm. Mhm.
meet everyone, and then after about 3 to 4 months, I started talking to patients and then recommending different courses of uh, means of ingestion for a range of different products. Um, and each state that has a medicinal program will have a range of things, symptoms and maladies and illnesses that the state allows you to get a prescription for
Mhm.
cannabis to treat. Okay, and it's very, these states that put these programs into effect are very coordinated. They do their research, and this list isn't the same with every state, but typically the list includes use of cannabis for treatment for seizures,
Mhm.
which has been documented and proved. All kinds of seizures, from Dravet syndromes to epilepsy, are successfully treated with cannabis on fantastic success. You have children, and that's a very special subset of cannabis users.
Mhm.
Um, because I don't necessarily feel that cannabis usage is appropriate until the brain has stopped developing.
Uh-huh.
And the latest studies I've heard, you see significant brain development occurring until about the age of 25. Um, but anyway, so there's some controversy in terms of using cannabis to treat children with seizures.
Mhm.
But on the other hand, with Dravet syndrome, you have children who will experience, you know, uh, not tens, but maybe even 100 seizures in a day. They don't have life. Their entire life is spent kind of curled up experiencing seizures, so they can't function. They can't. It's hard to eat. Often they have things in their bloodstream, or they're
Mhm.
fed. They're not. They haven't been able to learn even. Their speech isn't properly developed
Mhm.
because seizure isn't something I've experienced personally. I've never had to deal with that, fortunately, but I've seen people have seizures,
Mhm.
and they're just kind of locked in on the ground, unable to function, unable to do anything. And um, with the usage of cannabis, so these children will reduce to occasionally no seizures in a day. Maybe the odd seizure here and there, but the use of cannabis allows them to develop. you know, they can learn, they can eat, they can interact, they can talk, they can have much more of a normal life, and that's big.
Mhm.
And really, there have been numerous prescription drugs made by pharmaceutical companies to treat all these symptoms, or all these this condition, but none of them have truly been as effective as cannabis. And the other thing that's really great about cannabis as a medicine is one, it doesn't have toxic,
Mhm.
it doesn't have truly toxic effects on the human body. When I started working with my brother, there had not been any deaths attributed to cannabis usage. It's not like as we talked in the previous episode, alcohol or cigarettes,
Mhm.
which contribute to tens of thousands of deaths every year in the U.S. alone. Um, and in fact, again, there are a lot of positive health benefits. And so I'll go down a small list. I didn't write this down, but again, there's seizures.
Mhm.
um, one fan one very interesting treatment, and again, I think cannabis is the only thing that has helped this, is called phantom limb syndrome. Have you
Mhm.
heard of that one,
No, no,
Sanji?
no, no, no.
It's when someone loses an arm, right? Whether
Oh.
due to an accident, or
Uh-huh.
maybe they were, maybe they lost it, in Southeast Asia, Cambodia, maybe in parts of Laos, and certainly in parts of Vietnam. They have unexploded ordnance still in the ground,
Oh.
so people will accidentally step on one and lose a leg
Mhm. Mhm.
to mines. But often, when someone loses an arm or a leg, um, they'll feel pain in the arm
Mhm.
or leg,
Truly.
and there's really, up until cannabis was found to treat it, there hadn't really been anything to treat that. Oh, and let me step back real quick and talk
Sure,
about,
sure.
because I mentioned the use of cannabis for epilepsy, and that there are numerous drugs that pharmacies have developed for epilepsy. But with all these drugs, there's so many horrible side effects,
Side
right?
effects. Uh-huh.
Um, it's amusing, when you watch TV in the United States, they'll have commercials for some of these drugs, and it's not just the drugs that have been developed for seizures, but all the drugs, almost, it seems, that are being developed for all these causes. When you see these commercials, the last thing they
Mhm.
do is list, the potential negative side effects, which constipation, headaches, anxiety, uh, feelings of suicide, and
Mhm.
and even occasionally death.
Oh.
So you have to make a big decision when you're taking some of these prescription drugs. You're like, if I take this, I might be treating epilepsy. If you're, but at the same same time,
Mhm.
I might also start feeling a tremendous amount of anxiety and having urges to kill myself, or maybe it'll cause some other cancer, or and there's always a huge list. And whereas with cannabis, when I was talking to patients, I'd say, this might make you hungry.
Mhm.
you know, this might make you sleepy. So when you consume this, it's a good idea not to use heavy machinery or drive long distances. Or you probably shouldn't drive in general when you
Mhm.
consume a lot of cannabis. But your list of negative side effects when you compare cannabis to pharmaceutical drugs is laughable.
Mhm.
But let's get back to that list. Phantom limb syndrome is an amazing one. It's hard to imagine not having an arm, and then
Mhm.
but that arm hurting to the point where it's very distracting. And cannabis is really and truly the only substance that's been known to successfully treat that. Other
Mhm.
things, I remember a long time ago when I was a kid, and I'm going to forget the name of this, but there's a condition in eyes in which the pressure inside the eye is negative in some way. I can't think of that, and I remember hearing when I was a child that marijuana or cannabis was useful in treating that. Yeah, I'm sorry, I forgot that. But then also, when I worked with my brother in New Mexico, we treated a lot of cancer patients,
Mhm.
and that was fascinating. One of the fellows that we were treating for phantom limb syndrome, and this guy was funny because he drove a motorcycle. So you're trying to think, buddy, how do you drive a motorcycle with one arm? That
Mhm.
doesn't seem very safe. But he also had, when he came to us, he also had stage 3 lung cancer,
Mhm.
and he'd been given 3 to 6 months to live. So we started him on a very aggressive, high dosage treatment of CBD and THC, which are the two primary compounds in cannabis.
Mhm.
And he wasn't afraid of the treatment because many people who don't have experience are kind of nervous about taking a jump in there. But he had a lot of experience with cannabis on a recreational basis. But
Mhm.
we started giving him capsules, which is oil, highly concentrated cannabis oil,
Mhm.
and it's way more than you could way a lot more THC and CBD that you could consume if you just smoked a
Okay.
cigarette. Right?
Uh-huh.
It's very concentrated. And I remember talking to him a year later, and he was ecstatic. He's like, "I've been given life."
Mhm.
And he wanted us to come and talk to his church, and I wasn't really comfortable doing that, But he felt that cannabis had given him many years of life. That
Mhm.
because again, when we first started speaking to him, he was given a death sentence. He was told, take
Yeah.
care of your affairs because we don't have the ability to treat this anymore, and it's likely that you're going to die in 3 to 6 months.
Mhm.
I've talked to some people who with breast cancer. I've known a woman with breast cancer,
Mhm.
and she had stores in Washington State, and she administered self-administered a heavy dosage of cannabis to herself, and she was still living 25 years after her first initial diagnosis of cannabis, and
Mhm.
had never. I mean, she didn't remove anything, and she didn't take any other aggressive treatments at
It
all.
was. Uh-huh.
Yeah. And then, that reminds me of another patient that I met. I might have talked about her briefly in New Mexico. And this was an older lady. I forgot the kind of cancer that she'd been diagnosed with, and she was quite nervous. Um, but we did have very, very good results. She wasn't given the death sentence. She hadn't been told that she only has a number of months to live. But the treatment alone, and she didn't. And let me also say that she also maintained the normal treatment for cannabis.
Uh-huh.
Irradiation. They did an aggressive operation where they cut out all the cannabis tumor that they could find.
Cancer
Um,
tumor, no? Cancer tumor.
yeah, cancer tumor.
Uh,
It was cancerous, and but we did say, this can, let's try this. We'll start you on a very low level, right? Low THC, low CBD regimen, and we did a 1:1 ratio. There were two parts of her treatment again. There was the CBD and the THC, whereas the CBD kind of relaxes your body while the THC kind of affects the way you perceive things and affects the way your mind intakes sensory inputs.
mhm,
Uh, and her desire after 3 months was to increase the THC component because she liked that aspect of the relaxing and the what they describe as getting high,
mhm,
uh, and that's what she really enjoyed it, and I was nervous because we'd had a great success. I felt you know I hadn't kept track. I mean, I haven't kept track of either of these patients since I left New Mexico.
mhm,
Um, it was a long time ago, but I also have to say, especially with cancer treatment, and I'm currently speaking to um, a family member who is undergoing treatment for cannabis. I mean, sorry, for cancer in Canada, and he takes cannabis regularly because it helps him sleep. You know,
mhm,
these drugs that they take, especially when these drugs are poisonous. They make you feel horrible.
mhm, mhm,
Your whole body aches and hurts. I mean, your urine is toxic. You have to be careful.
mhm,
And but the thing that everyone will tell you is that they can at least sleep well, you know, and
mhm.
that's so important in the healing
Yeah, yeah.
process.
Mhm,
When you're healing, you're let's be honest, your body heals you, and you have to take care of your body. And one of the best ways to allow your body to heal itself is by sleeping. Shut everything down, lie down, and just rest. And consumption of THC and CBD or cannabis in general
mhm,
helps you sleep. It helps you, um, it it helps you eat, and that's another huge problem with cancer because these drugs, you have no appetite, and you have to eat to feed your body so it can heal. So it helps you a lot with your appetite. Um, that's just so important. And when you're taking pharmaceuticals, and especially the drugs that are designed for cancer, they take a toll on your body. You can't sleep, and you can't. It's very, very hard to eat because often you're just throwing up. So it settles all of that. And I'll reference quickly one one. I remember reading one study that was conducted in the United States by a respectable institution. Harvard was one of the leads in this study, and in this study they determined that THC um, helps kind of to kill the tumor, cancer tumor
Mhm.
itself, while CBD stops the metastasizing.
Mhm.
So when you take cannabis as medicine, and this wasn't for every cancer. There are many, many different cancers, but this is primarily for breast cancer and prostate cancer. They found that the combination of CBD and THC was hugely beneficial in terms of treating cannabis.
Mhm.
And you'll hear of I've heard anecdotally of cancer being used to treat and in some cases absolutely eradicate some cancer. I haven't met anyone personally. I've seen some of these stories and read about them. I've seen them on YouTube and read about them in magazines. But and you're always skeptical because it sounds like a miracle drug.
Mhm.
But um, gosh, if it helps, then that's fantastic. And also, there's some aspect to the well, I don't want to get into that honestly. Sorry, let me retract a little bit and go back to my list. Um, and some of the other things that cannabis can be used to treat are headaches, migraines. I've known people who've treated migraines with cannabis. um, but there are some things that can be there are certain mental health disorders which
Mhm.
people should avoid, from what I understand, schizophrenia and bipolar people should avoid cannabis. And also if there are other good, safe treatments for sick children, I think it's probably a good idea to avoid using cannabis and
Mhm.
letting the brain properly develop without that exterior influence for as long as possible, for sure. And then the list is huge.
Mhm.
Um, I know many women who take cannabis to relieve menstrual cramps.
Uh-huh.
Um, it's very effective. Uh, and what else? I know, for eating disorders, bulimia, it's a
Mhm.
huge success rate there. Um, and, also occasionally people have used cannabis to help them get off other drugs.
Uh-huh.
It can be a substitute for things like opioids and and even alcohol. Honestly,
Mhm.
uh, that kind of brings me to another thing that I wrote down, and we don't have a lot more time to talk about this, but
Mhm.
and that's the unfortunate stigma that's attached to
Uh,
cannabis.
Scott,
You know.
let's shall you do it the next week?
Okay, yeah, we can talk about the
Because
stigma
it's a big
next week.
topic, and this I think really we should address.
Hmm.
So I think like you covered, so we can call this what you mentioned as benefits today, right? If
Yes.
all these things you said
Hmm.
can be taught as benefits of using cannabis, right?
Yeah, and we could talk about stigma. I mean, and that's a topic, because we can talk about the reasons that it's
Uh,
the stigma has been attached to cannabis,
sure.
and there are many reasons that's
Uh,
occurred, and I think that would take
and
a
specifically,
good
Scott, if
episode.
possible, please.
You want to meditate?
Yeah, no, no, like
Oh.
we'll do like another part of this topic, like how
Hmm.
can cannabis be used for cancer treatments, eh? Cancer treatment,
Okay. Oh
because
yeah.
you
Okay,
mentioned
we
it
could.
a lot.
Hmm.
So if you can show like how it can be used, you mentioned a few places, like the
Yeah.
gentleman who took those capsules, those
Hmm.
ladies and all. But please like bring that topic more up. So I think it will be a great thing because many people are suffering from chemotherapy, these kind of things, or removing parts of their body. Sometimes they just cut off a part of their intestines and then, but it still grows. So
Hmm.
I think like before, even before the misconceptions, if we can bring up something like the specific, particularly like treatments for things like cancer, because it's spreading like wildfire everywhere in many societies, many
Absolutely.
places,
Hmm.
and they are just promoting like, and they say like the maximum, okay, maybe 4 months after all that treatment and all the spending and everything. Sometimes they
Yeah.
say just the extension of life is just 4 more months uh, after the treatments
Wow.
also, no, they have to go through all this,
Yeah.
and they
That's
cannot eat,
crazy.
they cannot sleep, even if they touch a wall, they are, and all of their like skin color and everything is gone, no. So
Yeah.
there's so much things happening, and then still if the extension is another 4 months, there's a lot of rethinking to do, right? So if we can
Hmm.
show that there are more options or like a very healthy way of things, and without all those things, like those people are really suffering, and they
Yes.
already have to suffer because of the cancer, and then the treatment is even more, right? And it's
Yeah.
super expensive also. So if
Hmm.
we can
Yeah. It's
introduce
very
something
expensive.
like even people from different countries, if they can use, that will be wonderful, Scott. Eh?
Yes. That's a good idea. No, let's
Uh-huh.
do that, Sanji. I like that
Okay.
idea. Yeah, because yeah, there's lots and lots of time. I mean, not time, but lots of topics that can be talked about, and that should be
Oh,
talked about.
yeah, no,
Because there's
surely.
so much disinformation out there too.
Misconception, we'll take it like a whole topic, because yeah, we always hear the misconceptions and ideology, and even if you do some search online, especially the negative side appears. Even in our societies, like we hear much of, I'll tell you when we talk about those. So
Yes.
it's funny, and uh, but yeah, I think we should put out the other side also, because
Hmm.
like you mentioned, like the other things that are supposed to be good also have plenty of side effects. It's very harmful, no, and people just pass
Yeah.
away while they are doing the treatment even.
Hmm.
Yeah, yeah.
Indeed, indeed. No,
uh,
that's a, yeah. As you say, you get into one subcategory here, and then it's like it has tendrils, and it's very fascinating. And but I think it's very important to talk about this stuff as well.
sure,
I
sure.
mean, but through all this, I am in the U.S. and I feel compelled to say I'm not a doctor.
Mhm.
I haven't taken years of medical studies. My experience is purely anecdotally, one-on-one basis with friends, family, and
Mm.
people I worked with when I worked with my brother about a decade ago in New Mexico.
Yeah, yeah.
Mhm.
That's the thing also,
So
Scott.
I'm
Like
just saying
because
this, like I do have direct experience.
surely, surely. No, that's the thing. Like people who should be qualified, they don't speak of this, no. So not that we are
Mhm.
condemning them or anything. We are not pointing fingers, but uh, like in that environment, they just prescribe some things that are allowed, and in some countries they are not even able to talk about it. But
Yeah.
some good doctors, even if they practice like Western medicines, they recommend.
Hmm.
They go beyond and they recommend, why don't you try these things? In Sri Lanka also, there are some good doctors. They say like, why don't you try like some other alternative medicines? So
Okay.
even when we were small, like these things were like demonized and put, and the specific group was only considered as. There are plenty of stories also. I'll tell maybe when you're talking about it. So
Yeah.
and then yeah, it happened, and there's a big history behind that also. But so I think that's why we should bring this up. And those people who, even who like Ayurvedic practitioners, first they were not they were not mentioned as doctors. They were not, but they are doctors. They are like super fine doctors, right? But they said no,
Uh-huh.
no, no, no. They are not doctors. Only these people are doctors. So, but they interact on daily basis. Some people even don't take money, or they do it for
Hmm.
free as a service, but
Yeah.
they really treat and people get better or even
Hmm.
cured. So
Yes.
let's dive deep in without hurting nobody. But let's
Hmm.
bring some facts and show people like there's plenty of alternatives and options, no?
Oh, absolutely.
O-
Absolutely. Yeah.
Okay.
Mhm.
So today we decided, Scott and me, like we decided like we do 40 minutes of this, actually Scott teaching us, and then we'll do like a 20-minute meditation session. Okay.
Hmm. Yes.
Okay. So please sit comfortably. You can use any way of sitting or any place of sitting, and be comfortable as much as possible. If you want, stretch, or if you want, stand and sit down again if you like, because you have maybe you've been listening to this for some time, and then you can have a specific particular way of sitting if you like. But just idea is to be comfortable and still as much as possible. It's like keeping a glass of water on a table. Our body is like the glass which can shatter also, right? But it's you as a glass, you can use it for many purposes, and you can clean it and do a lot of things also, right? And it's like a vessel that can keep. So the mind is like the water, which is very important and very useful. So easiest way to keep it is like if you keep it, place it on a table, and we can sit back, relax, and observe it. Okay, so let's do some upgrades of last times. So we just again reminded ourselves of loving kindness meditation, breathing meditation. So let's do the relaxation. So even the posture and everything, we try to use it and go more and more towards like learning to relax or settle down. That's the idea. Okay, so you can move your body, even shake it if you want. You see, even boxers before they fight, they'll even like loosen up, but they're going to fight, right? But still they loosen up, no? So
Hmm.
the muscles and everything. So you can move your body and just align it in a way that makes you more comfortable. Even the fabric of your clothing, if you feel it's somewhere tight or something, you can loosen up and then use the breath to settle it down more. So the idea is like we go more and more. So if you are seated for like 1 hour or something, you can change the posture many times even. But if it's for a smaller time, just try to be still, like the glass of water. If you move the glass of water here and there, the water, there'll be many ripples, no? So but if it's for like 10 minutes or 15 minutes, just try to be still as much as possible. Then it really helps. Then let the breathing, focus on the breathing. And you can take deep breaths from your nostrils and keep in the breath for some time. And then slowly exhale from the mouth. And with that, each exhale, let it release any kind of tiredness or anything, or just loosen up with the breath. With each exhale, let the body also loosen up. You'll feel your shoulders moving, your abdomen moving, your chest moving. With each exhale, breathing in, keep it inside, and then slowly exhale from the mouth and release and let go. So, actually, what happens is more you let go, relaxation happens. Physically, also, it's the same. Definitely, mentally, also, it's the same. We let relaxation happen, and then slowly we'll do like a body scan. So you can do a few rounds of this breathing, intentional breathing. You can incorporate with the body also, breathing in and breathing out, intentionally breathing in from the nostrils. Take a deep breath and keep it in for some time, a few seconds, and then totally let go, like releasing it, like as if you're emptying your lungs. It's like you run and suddenly stop. then the breathing is more intense. You take one breath from your mouth, but actually it lets you settle down. Even everything, the heat of the body, the heartbeat, everything starts reducing. It makes you settle down. We are doing it intentionally, so we were not running or anything, so we can get that effect. And then let's focus on the body. Slowly take to your scalp region and just see, like, as if you are releasing a clenched fist. Slowly let go, releasing and letting go. Then slowly bring your attention to your forehead region. If possible, all those thinking lines and all, let them spread out. Any tension, you feel the tension. You say you are frowning, you can feel the tension. So just let it spread to either side of the body. We can really feel this.
Right.
Okay.
Right.
And then slowly to your eyebrows, let them drop to either side. You can feel, no, like when you are frowning or when you're angry, upset, thinking, the eyebrows come together. And then especially the eyes. If you have little bit of even pressure, we'll feel it, especially in the upper parts of the eyes. And you can just let the eye muscles drop to either side, or just let them loose. You can really feel it because we tend to like grab hold of them and we focus them here and there. But now we are not using the physical eyes. Then slowly come down. You might feel the breath and check on the teeth and the tongue. And you can release the jaw muscles. Then one whole side of your face, all the way from the cheeks to the chin, and the opposite side of the face, all the way right up to the chin. Then the back of the head. If you want, adjust the posture, make it more balanced, and then slowly move down to your neck region, the front part of the neck, back of the neck. Then moving down to the shoulders, you can just drop your hands on either side or right in front of you and release the shoulders. We are either pushing it up or we are supporting it with our elbows. But there's no need actually. Just make them as if they are made of rubber or they're sleeves of your shirt or jacket. Make them loose as much as possible. You can feel the tension or anything or excess effort releasing. And then your chest region, the abdomen, upper back, lower back. Then select one of those arms. And then from the shoulder to the elbow, elbow to the wrist, all the way right up to the fingertips. Even putting our attention changes things. And do the same to the opposite arm, shoulder to the elbow, elbow to the wrist, all the way along the palms of your hand, right up to the fingertips. You can feel even the heat, you can feel. It's very nice to feel your body and it brings us to the present moment and you're more grounded. And then the lower part of the body also, you see whether you are seated comfortably. And just like the arm, select one of the legs, the upper part of the leg, the knee, the middle part of the leg, and from the ankle all the way, just like the palms of your hands, the soles of the feet, right up to the toes. And do the same to the opposite leg also, the upper part, the knee, the middle part, right up to the ankle, soles of the foot, and then right up to the toes. So the whole body, if you're when you're practicing by yourself, you can do 5 minutes of this. Like take 5 minutes for breathing, and like body relaxations. So last time we did like five parts of the body to keep mindfulness. So actually that helps to reduce the craving sides or the greedy side of the mind, which actually reminds us of many things. So we said head, hair, body hair, nails, teeth, skin. Head, hair, body hair, nails, teeth, skin. So now if you want, you can slowly place your hands, but very mindfully and slowly. We don't want to disrupt anything we made. So slowly bring your hands and slowly place them in a comfortable position where you like. Some people place it on their knees. Some people like to place it on their lap. And now you know like where your maybe the fingernail of the thumb is there. And we do, as we mentioned, we do like a upgrade of that meditation, but it's not to feel disgusted or anything. It's nothing like that. So we say like head hair repulsive. Repulsive means think of a time you were doing some hard work or something, and there's sweat touching the hair or the bristles of the hair, like we do now. And and then like think like body hair, like the sweat was pouring on your eyebrow. It's not to feel disgusted or anything, just to like feel the reality of it. Yeah. Just to feel the reality of it. Sometimes even if you take a shower, sometimes we can sweat again, especially in the warm seasons, right? Or when you're sick, or if even if you take sometimes a warm shower or a hot shower. So head hair repels you, body hair repels you, and then slowly move to your thumb and think of the time you were working, maybe with soil, or you were cleaning something, and some kind of like dust or soil that was applied on your thumbnail. Just think it as repulsive. That's why we clean it, no? And then the teeth repulsive before brushing your teeth. Uh, And then the skin. Repulsive means think of like before washing the face or cleaning it. There's like sweat, or there can be like kind of like oil. So just think of that. But it's not to feel disgusted because we get it. No, it's a fact. That's why we clean ourselves. That doesn't mean we have to be dirty or like, no, nothing like that. But just is a reality of the body. So what it does is it's like kinds of frees our mind. It free gives us freedom for the sixth sense to appear actually. More you put out the five senses, actually the sixth sense comes alive. So we are just like separating ourselves. Others we are so attached to our five senses. It's very fabulous. When it goes to the next level, you can just draw it out. Some people call it the third eye, some people call it the sixth sense. But you can do. But you have to remove that kind of like clinging towards the five sense doors. That's why we bring this particular kind of meditations. So that is an upgrade for today for that particular meditation. So you can practice like 5 to 10 minutes of this, which is very nice. There are ancient methods, ancient ways. This is all wholesome. Like usually when you feel disgusted, it's anger related. You feel disgusted. I hate it. No, I yuck. This is nothing like that. Your mind becomes calm and even peaceful, and you can reach like very powerful concentration stages. So it's the opposite. Never we think it like as disgusting. Just the reality of it. That's why we brush our teeth. That's why we take shower. That's why we clean ourselves. And then to smooth things off, let's go to loving kindness meditation. And we'll do upgrade of that also today. So now since we did the body scan and everything, And this particular meditation of those five parts, we know our posture very well. So take yourself as the meditation object. And what we can do is, may I be free from anger, may I be free from mental pain, may I be free from physical pain, may I live happily and peacefully. Just those four. May I be free from anger, may I be free from mental pain, may I be free from physical pain, may I live happily and peacefully. You do a couple of times for yourself, and here's the new part. Take somebody who is still alive and whom you have lots and lots of respect. Lots of respect. Like, even if you have never met this person or talked to this person, doesn't matter. But should be a person who is still alive, who inspires you. It's like a role model for you. Uh, and maybe you have never met this person or talked to this person. Doesn't matter. But take this person and think, because it brings a pleasant feeling soon as we think of this person, because this person inspires. Sometimes our parents also, sometimes we might have arguments with them, disagreements. So sometimes that effect doesn't really come. But if you take somebody, even if you have never met and you have like tons of, luckily we had our like great teachers, so we didn't like really associate them very closely. You cannot like associate them like a friend, no? And we had like tons of respect towards them in a very loving way or caring way. So it was so easy to practice. So think of somebody, take your time, no hurry, anything, and think of, but definitely they should be alive. We cannot think about a past person, no, like some spiritual figure or anything. We cannot do like Jesus or Buddha or anybody like that. Uh, they should be here, like in the present time. So think of somebody. It could be any field, any person, and you have but tons of respect. And just think, take their image to your mind, and just think, may this person or may this good person be free from anger. Doesn't matter if they are even enlightened. Doesn't matter. This is for us. More we focus it towards outside, it helps us because we are projecting it from our hearts. Just like for me, may this person be free from anger. May this person be free from mental pain. May this person be free from physical pain. May this person live happily and peacefully. That's all. The same four verses, but now we are using it externally. So this is a place actually this meditation starts growing. So if you can do 5 to 10 minutes with this also, so you can do like changing also, one time for you, one time for this person. But always like few cycles towards you and then bring up this person. Then after that you can do like one time for this person, one time for yourself. And then let's slowly go to the breathing meditation part. This is a key part. And we'll do upgrade of that also today. So slowly bring your attention to your nostril region. So we use the other two meditations as supporting meditations. And we are on top of that, we are trying to build like a pillar, this our main meditation. But you can choose any of these, or what we'll be discussing or practicing in the future also. And slowly bring your attention to the small area from the tip of your nose to the upper lip region. And you can do some intentional breaths to get the feel of it. like the breath touching that region and going inside the nostrils, but don't follow it all the way. That's too much work. And the breath will come out, touch that specific area, and go out of the body. So the great masters have asked us to like keep it very simple, uncomplicated. I'm not at first telling it's easy, but actually it is. It's much more easier than the tons and tons of things we do every second. We are so used to doing that now, but this is much, much more simpler and uncomplicated. That's why we can feel at ease and bring in the comfort. And then when you're practicing for 5 to 10 minutes, if your mind wanders, just use like two words: inhale, exhale. Or you can use multiple words: breathing in, breathing out. Or you can use some beautiful words like breathing in energy and putting out kindness or care or peace. Breathing in energy or life and then putting out peace. Anything that like really resonates with you or according to your preference. That will help to keep on track. So please, like if you can practice 5 minutes of each relaxation, the five body parts, the five the loving kindness and 5 minutes breathing. So that will make a very nice schedule for your mind. So finally, to finish our session of meditation, we already went for like 20 minutes already. Few more seconds left. It went so fast, right? So just think in your heart region, may all beings be well, may all beings be happy, may all beings be peaceful. Because we have like this nice energy with us now. May all beings be well, may all beings be happy, may all beings be peaceful. May all beings be well, may all beings be happy, may all beings be peaceful. And then slowly move your attention upwards. And they say like the eyes are like the windows of your soul or your house. So slowly with these beautiful intentions and all this positive energy and everything, slowly open the windows, focusing it outwards also to your day as well as your life and the journey. And you can slowly open your eyes. Okay. So then let us finish our discussion for today. Thank you so much, Scott. And it will be a great pleasure for us to learn from you about benefits for like cancer treatments. And then maybe another day, just according to your preferences and how you're comfortable with it. And another day, maybe like for like particular all these misinformations or like speculations and all. We also have like things we hear from small days maybe just to
Mm-hmm.
frighten us. No, like and but we have seen something, so I would like to express them, hear those things also from you. So I'm not trying to put you in the deep end or anything. It's like things we
No, no.
saw, and then we can ask like maybe you have answers for these also. And
Yeah.
so thank you so much, Scott, and everybody who is like uh, watching this later on. And please feel free to like even contact Scott or me, and we'll be putting Scott's details so you can contact him directly also. And there's a lot of things we can learn from Scott. So thank you so much, Scott. Have a beautiful day, and for everybody,
Thank you.
have a wonderful day. And thank you
Thank you,
so
Sanji.
much.
That's Thanks for the meditation. That was wonderful. I appreciate it. And
Oh,
look
no,
forward
you're
to seeing you again in a week.
most
Mhm.
welcome.